Good afternoon. My name is Carl Muller, and I'm the Executive Director of the Campaign for Public Health Foundation. Our organization is dedicated to educating policy leaders, the media, the public, and others about the value and importance of public health programs broadly. And I want to thank you all for attending today's briefing on injury prevention. You know, we hear a lot, I think, about treatment of illness and disease, and unfortunately, or fortunately maybe, when Johnny Jones falls off his bicycle, hits his head, and doesn't make the newspaper because he had a bicycle helmet on, we don't hear anything about Johnny Jones. So it's a quiet success of public health when that sort of thing happens. Today's briefing is a culmination of work that started actually back in November. The Campaign for Public Health Foundation worked with the Society for the Advancement of Violence and Injury Research, as well as with the National Athletic Trainers Association, Safe Kids USA, and Safe States Alliance to execute a grant we'd received from Pitney Bowes to create the fact sheet on injury prevention that's outside on the table. It goes into a little packet that we've been working on since 2009, and the injury prevention fact sheet is the latest addition to that. We're actually releasing it today with this event. Today's event, though, wouldn't be possible without two very important members of Congress, Congresswoman Lucille Roybal-Allard and Congressman Jim McGovern. They are the co-chairs of the Congressional Study Group on Public Health. That group actually was founded in 2006 when our sister organization led a tour of the CDC for congressional staff. And on their way back, they said, well, you know, we should get CDC folks up here more often and learn more about prevention and public health efforts. And we have representatives from both offices here today. Lisa Salerno from Jim McGovern's office is in the front row, and Debbie Jessup with Congresswoman Lucille Roybal-Allard's office would like to kick us off with a few words, and then we'll defer to Mary Kay Appy, who will introduce speakers and moderate today's event.
So Lisa and I were, well, Lisa, you weren't on the trip. I was on that trip. Your predecessor was on that trip, and our bosses co-founded the Study Group on Public Health. We, in the past, have had more frequent briefings. We're trying to ramp up again and get going with briefings. We, in the past, have had every month or every other month briefings. And so if you like today's briefing, we would love it if you would consider joining the Study Group on Public Health. We get together and we talk about what we can do to raise the focus of CDC and the importance of public health in Congress and in this country. So.
Absolutely. I would definitely encourage you to get your bosses to sign on. We're, as far as we're purely educational briefing, and you know, there's no hard sell on legislation for the most part. So it's a pretty low commitment caucus, but also we're very much open to if members have a particular interest in public health or specific interest in public health. We're definitely open to that as well.
So welcome and thank you.
Good afternoon. I'm Mary Kay Appy, President of Safe Kids USA. And I'd like to start out by pointing out the fire exits from this room. If the alarm were to sound, we'd go out that way, take a right, and we'd find the exit stairwell. The first stairwell on the left will take us directly to the outside. However, we are in a fully sprinklered building, so we're feeling really great about that. We're here today to address the prevalence of unintentional and intentional injuries. And the good news is that many, if not all of these, can be prevented if families and communities and our government all take a role in making that so. The opportunity for a solution, little competition there, has never been greater. So this briefing is an opportunity for all of us to share our research methods, our case studies, and our programmatic initiatives. Each speaker is going to have a couple of minutes to discuss what they've come to share with you in terms of lowering the incidence of injury and violence in our nation. And we're going to begin with Dr. Linda DeGutis, Director of the Centers for Disease Control and Prevention's National Center for Injury Prevention and Control. Dr. DeGutis joined the CDC in 2010, and she's already made her mark on the agency with her passion and dedication to prevent public health her passion and dedication to public health research and policy interventions. Her collaborative spirit makes her the ideal person to be leading this agency. We're very proud and happy to have her there and here with us today. Please help me welcome Dr. Linda DeGutis.